All right, everyone, welcome to this episode of Delano Podcast News. My guest today is Natalie Rivera. She is an associate marriage and family therapist from the Child Guidance Clinic here in Delano, so stay tuned. Welcome, Natalie. Welcome to the episode.
Hi.
Hi. So you are a associate marriage and family therapist.
Yes, associate marriage and family therapist.
Yes. So give us a little bit of insight just into that. And then I know you have your topic is on, today we will be discussing a little bit about mental health first aid. So give us a little bit about yourself real quick.
Yes, so I am a associate marriage and family therapist at Child Guidance Clinic. So we work with children and families getting through some mental health symptoms and behaviors. Me personally, I work primarily with teens that have anxiety and depression. It's something that I've been doing for the past 2 years. So I really like it. Our clinic is really pushing forward to try to put our name out there in our community so that we can get as many people as need help in our community. You know, we want to be able to break that stigma here in Delano with the Hispanic community as well. You know, not a lot of times people want to receive help or they're not sure how to get it. And so we just want to make sure that everybody knows that help is out here and we're able to provide them with that help that they need.
Yeah, I know on the last episode when Marcella was here, that was something that she talked about where not a lot of people know about it. So it's kind of like a hard thing for people to really see or to kind of seek out. And you also have that stigma. It's like the whole Hispanic, whether it's a male, it might be a machismo thing or something like that. And I mean, you really, as everything is nowadays, I mean, no matter what, it should be something you should be able to seek help for.
For sure.
So, I mean, talk to us about first aid, mental health first aid. Well, explain to it and then we'll get into little things if we have any questions, of course. So,
right. So mental health first aid is actually a really good way to get into the community to break that stigma and educate the community on mental health issues that are around us. So, you know, mental health first aid is what it sounds like, first aid. So, you know, people for their jobs, they get certified in just regular first aid where they help people who have an injury, what to do when there's like an emergency, how to do CPR, how to respond to someone who's physically hurt at the moment. So mental health first aid is exactly that, what for symptoms and behaviors that come along with mental health issues. So for example, if someone feels anxious, if somebody has some sort of depression, if there's a panic attack, if someone's feeling suicidal, if someone is trained in mental health first aid, they will learn how to respond to that person, not necessarily provide treatment, but just how to respond to them in that moment and get them to the road of recovery.
So would this be like something that someone would want to, so say you suspect something is a family member, a friend, or someone has a mental illness and maybe they want to be trained. Is this something that anybody can be trained in, or is it specific to a certain person or certain people?
Yes, anybody can be trained in mental health first aid. And actually, I was reading this morning that about 52,000 Californians are trained right now. And so we're working really hard with Kern Behavioral Recovery Services to train as many people in the community that we can. I myself am a certified trainer, and I have a coworker at Child Guidance who's also a certified trainer, and we both do trainings here in the community as needed. So we are willing to train as many people as we can. We actually currently have 2 trainings available. One is for adults on how to respond to adults, and then we have one for adults on how to respond to youth.
Okay.
Yeah.
So are there dates available for that, or would they contact the Child Guidance Center for something? Say one of the viewers watching the episode wants to, maybe they have a family member or someone or someone that they might think that this would be something useful for. Is that available, or do they need to call in for that?
Yeah, so they can contact us at Child Guidance Clinic at 661-725-1042. They could ask for Kanuli, our program manager, or they can ask for me, Natalie Rivera. They can ask for Marisol Garcia, and we will connect with that person to be able to come up with a date and time for this training. We can do it one day, we can do it 2 days. It's an 8-hour-long training. So we can just get creative with it to help those people get the training. What we do require is having a minimum of 5 people in your group. And then other than that, I think a maximum of 30 maybe. And then we will get all the information and materials, because it comes with materials too. They get a manual that they can use to read up on their own time, that they can use for future references. And so it's a really good training. I really like doing it.
So you said over 50,000 in the state of California are trained in this?
Yes.
So what is the basis of it that you would need training for? Is it just a general thing, or maybe someone in your family has a mental illness that you would want to get this training for?
I think it's good just to have it in general, whether you have someone in your family that has a mental illness or not, because at our jobs, we work with people, everybody works with people on a daily basis. And so sometimes we get situations in our jobs or even in our just regular day life where we encounter someone who might be acting in a way where it's concerning. And then sometimes people are afraid to approach that person or just don't know what to do. And so when you have that training, you're able to provide a little bit of assistance at least and be a little bit more prepared on how to maybe assist that person or make that person feel comfortable, just anything in that sort of way.
Some of the kind of, I don't know what I would say, either a trigger or something that would want someone would want to get this training. It could be anything from depression to any type of severe mental illness like schizophrenia or bipolar disorder, anything like that. Like depression, what's something, could you give us some examples of any first aid for any type, say someone's just lost a loved one, that's an immediate, someone could feel some type of depression from that. What could someone do? Or someone's going through something, a loss, either a breakup or something. What would they be able to do? Or what could you look out for?
So something that we really emphasize in the mental health first aid training is we have like a thing that we called algae. And so it's kind of like in CPR where they have CAB, which is compression, and I don't remember because the rest of the thing. But for algae, it's just steps on how we handle someone who is experiencing certain symptoms and behaviors. So for example, the letter that I really want to emphasize in algae is the letter L, because that's a big thing that happens in therapy and in just overall. It stands for listen non-judgmentally. So something about people who are experiencing signs and behaviors of depression is that they want to be heard. And so listening non-judgmentally is in a way where you're listening to the person, what they actually have to say without trying to come up with a way to fix them or, telling them that they shouldn't feel that way. And so I really like that part of the training because regardless of what the symptoms are, that's one of the things that we really emphasize for people to do is to listen. And some way, I know you asked about how you could recognize maybe something like depression. It teaches it in the training, to recognize when someone is basically acting differently than what their norm is. So if you see someone who's usually social, who's always wanting to go everywhere with people, stuff like that, if you start noticing the opposite where suddenly they don't want to talk as much, when they're not really wanting to be social, they seem down, that could be a sign that something is happening, whether it's depression or something else.
So it's to me, that's a typical like communications kind of thing. So because what I learned in the past was like when someone's like that, it's like when you're listening to someone, you want to listen. In that moment you think you want to respond, you just want to wait and kind of give them that extra and just keep waiting, because sometimes people will, even though they stop, there's something more. And if you start to, it kind of holds them back from still opening up. So, I mean, I always suggest to people when they're talking to someone, it's like, if it sounds like they're done, just give a pause, wait for them, because they might just start up again and just keep going, and that's more information that you can learn about the person. And because I know a lot of people, they have the tendency to want to just cut and kind of like interject their own opinion or their own way of kind of tell someone, like, to want to stop, and you don't get the full story about everything when you're talking to someone. But that's great to learn about that. Is there any other types of first aid, anything else that we can learn?
There's just a lot about, like I said, about mental health first aid. And so the main thing about it is that we just want to emphasize that there is a chance for recovery. We want to break that stigma. And so one of the other things that's emphasized during the training, as a trainer, to the people that I'm training, I like to emphasize, like, this training is not to help anyone diagnose anyone. So we're not here to put labels on anything. We're just here to be able to recognize signs and symptoms and behaviors that are occurring that might be concerning, and just how to provide support, because it's all about providing support.
Now that could be another stigma too, right? Because that's a fear that people might have. Is like, well, if I go for these services, am I going to get diagnosed? And sometimes the fear of being diagnosed is worse than well, I'm not going to get help because I don't want to be diagnosed.
Right.
So, that's good to know that, everything is going to be. Now, of course, if you're diagnosed, and of course you need to seek help for that, and that's what the services are for. So, there's just so much information that people can learn from all that.
Yes.
Now, student-wise, you say you deal with teens, right? And young adults. Even in Delano, so we all think that's a small town. We're what, 50, maybe 60,000 people. So I forgot how many kids we actually have in our school system here. But so is this still a large amount, right? So that's kind of hard to ask on that. But what are the main triggers or problems that kind of cause this thing? Is this just like a day-to-day thing? There's outside factors. There's outside, environmental thing that causes them to cause all this, or socially the way it is. Because to me, when I went to school, it feels a lot different than the way that kids go to school nowadays. It feels a lot different. So, does that have a lot of like peer pressure? There's always been peer pressure. Even when we go to school, it's always been like that. But is there anything that people can do to kind of reduce any of these things, or it just kind of happens kind of thing?
Yeah, it's a really hard question to answer because of the fact that you're right. There is a lot of triggers. It's a lot of factors. Everybody's different. So for one child, there might be a trigger where another child might not have that same trigger. But it all goes back to what I said about the mental health first aid is listening. Because a lot of the times, teenagers feel like they're not being listened to. It's really hard for adults to listen to teenagers or children because we have our own things going on and we're busy, and we think, what they're going through is not really a big deal. Like, I have worse things going on. But we have to remember that for teenagers, that's their life. They don't have adult problems, but those are children problems, and they're still problems. And so listening non-judgmentally with a teen can really help them, because then they feel heard and they feel supported.
Now, that is another stigma, right? That parents have on that, because parents are like, oh, that's just something else they're going through. Just let them go through it and whatever. And that's not a good thing to just say whatever on that, because there could be something more, and then that can cause it to build up. And then that's when you start to see problems kind of occur in school, either behavior, like anger, they start picking fights, or they start doing that, or they start bullying someone else, or just there's a whole kind of can of worms that kind of open up on that. Say it's like first aid. When I think of first aid, it's like how you said, it's kind of an immediate help to someone. So, does that training include someone that might be suicidal?
Yeah.
Because, I see it more and more around, and we see a rise in the amount of kids that are kind of committing suicide. And it's like, there's more options. That shouldn't be a door that you have to take. So, in first aid, if you suspect that your child or loved one might be having suicidal thoughts, what's something that you can first do as a person, as a loved one? What's something that you could do?
Ask.
Just ask?
Just ask. And that's something that's taught in mental health first aid. We do go over suicide in both the adult training and the youth training. And in both trainings, we emphasize just ask. And we train how to ask appropriately. And so basically we just say, ask directly, don't beat around the bush. Just be like, hey, I'm concerned about you. Are you feeling suicidal? Are you thinking about killing yourself? And just asking that brings so much relief to someone who might be thinking about suicide.
It's such a simple question you think to ask, but it's like, is it really that simple? And if you're saying it's that simple, I mean, but like you said, there's a certain way you kind of want to ask. You just want to ask, hey, are you going to want to commit suicide? That's obviously not the way to ask someone.
Right. There is a specific way on how you have to ask these things. And that's another thing that's said in the training too. It's like, you can't just be like, you're not thinking about suicide, right? Or are you thinking about suicide? It's all about tone. It's all about your facial expressions, your body language. But if you're calm about it and you're truly concerned and you asked, hey, I'm concerned. I've noticed these things about you. Are you thinking about killing yourself? Then they don't feel attacked. And they'll feel more comfortable to be like, you know what? Yeah. And so it's all about approach.
Well, I mean, some people can kind of relate to just having that blip feeling of that. Because, I mean, everyone goes through problems or issues, or they go through something, and that thought might just either be there for a split second, or it might just linger on in someone. I mean, I forgot what the question was I was going to ask. But
It's okay.
How common? Well, obviously, it's pretty common that people kind of go through that. But I mean, is it necessarily a psychotic thing? Because I mean, that's the first thing kind of some people think is like, oh, they have psychological issues. But I mean, any kind of issue or any kind of problem that you're going through is psychological, right? So I think I'm going in circles right there with that question. So I mean, let me try and rephrase.
Are you trying to ask like how normal is it?
Yeah, like how normal is that? Like how normal is that for someone to go through that?
Honestly, I mean, I wouldn't be able to tell you because I'm not inside of everybody's brain, but I do feel like it's pretty typical. I mean, it's a thought that can cross anybody's mind. You said it yourself. It could maybe just be a split second. For some people, it might linger. And I think it's okay to have those thoughts. Sometimes we feel like so stressed or so down that it crosses our mind. But, we just need to recognize that we need that support and figure out our way to get through it. But I think it occurs through a lot of people. I don't think that's something that's super abnormal or anything like that.
So that's what I wanted to, now that you said it, that's what I wanted to ask is like, because someone that might be having suicidal thoughts, they might overreact in their own mind and think that there's something majorly wrong, but it's something that an average person could go through. And it's kind of, would you say that if someone has thoughts like that, it's okay to have that and then just to kind of seek out help for that? Because a lot of people are like, okay, that's wrong. I'm feeling these thoughts. It's wrong now. They feel even worse. So to kind of say that it's okay if you do have that, because then there is help and there is support for that.
I think it's okay to talk about it for sure. Like, don't be afraid to talk about it when you have those thoughts. Make sure that you get that help that you need. Because a lot of people, going back to that whole stigma thing, they feel like it's not okay to talk about it. And so they keep it to themselves because they don't want people to think that something's wrong with them or like they're crazy, We're trying to stray away from using that word. And that's what we automatically think when we have thoughts like that. But if you recognize like, you know what, I need some support, I need to talk about this with somebody, then that'll be very helpful. And so that's why in the mental health first aid, we train our people to ask the question, because a lot of the times people don't want to talk about it because they're afraid. And so when somebody asks them, they're like, okay, I can talk about this.
Is there any preventative care? And when I'm thinking first aid, sometimes there's always a preventative that you can do. There's always something you can prepare for. As far as mental health first aid, is there any preventative care that you can do for someone before? Obviously, sometimes you don't know until it actually happens.
Yeah.
But is there any way to be preventative about it, whether they've had a history in it and you just kind of, it's okay, they've come back from this and they're okay, they kind of bounce back on everything. Is there anything preventative in that training, or is it just kind of at the emergency that it happens?
Yeah, that training focuses more on like how to respond when it's already happening, not really preventative. Basically, if I were to think of anything preventative, it would just be like taking the training and just becoming aware of this would be preventative. But using the training itself, that's more of a how to respond. And it's just like a little window, like this is how I respond. And then after that, how do I get resources for that person? And after that, the mental health first aid trainer doesn't have to continue on the journey with the person that they help out, but they are there to support and bring that resources like therapy or whatever other resources they might need to help that person at the time.
Now, without kind of getting into the class, because I know you kind of have to take the class to really get the full idea of everything to kind of learn it. Is there any tips or any kind of examples you can give on here without saying, okay, you have to get certified for this, or you have to really take the course to learn it? Is there any tips that you can kind of give to anybody watching this, whether it be family members, parents, to kind of look out for?
Well, like I mentioned, be aware of when someone's acting differently than what their normal is, and then just ask, hey, this is what, point out what what the concerns are. So notice that something's going on, point out, hey, I'm concerned because this is what's going on, and then ask what's going on and listen. Again, listen non-judgmentally. And if there is suspect of suicide, ask directly. And those are the tips I have. So
it'd be like say it's a young adult or a young teen, and be like, okay, isolation. You notice they're a little bit more isolated. What would be another one? Grades. Yeah, grades slipping, dropping. Is there any other ones any kind of, I don't know how you would say it, markers kind of to look out for? Again, just changes in their personality. Because I don't want to say, you have to look for a specific thing. Yeah. Then some people will look for that specific thing, and that might not be it. Right. Or some people, that's just their personality. And then the parent's going to assume like something's wrong with you, but that's not really what's happening. That's just their personality. So it's just about changes in the personality. So on an individual basis, you kind of got to be like, okay, this person, you're going to know when there's something wrong. Like you always know a friend, I was like, hey, what's going on with this? This is not the normal person. That's kind of that would be a trigger for that. Right. And if you have a gut feeling, ask, because usually your gut feeling's right. Yeah. Yeah. On that. Is there anything else you would like to add? Anything more that we could give any information for everybody? No, I just want to remind everybody that if they have any children and families that are in need of our services, Child Guidance Clinic is here in Delano to help out with, and McFarland as well, by the way. So we service Delano and McFarland. So just call our clinic, come into the clinic, try to figure out what kind of services we can help you with. The same thing, if there's any agency or group out there that is interested in getting mental health first aid, we offer adult training and then for adults to help youth. So just contact us and we can set you guys up with how you can get trained. So remember, we're located at 1430 6th Avenue here in Delano, and you can call us at 661-725-1042. All right. Well, Natalie, again, thank you for being here on this episode. We hope this information gets out to anybody that needs it. Hopefully, if they are in need of this, that they can get a hold of you and take that certification, kind of help their family members. Because, it's a very touchy issue, and a lot of people know information about it, or they're scared to kind of want to get into it because of outcomes. People have their opinions, and it kind of gets a burden on them, so they're just like, oh, I don't even want to go there on that. But again, thank you, and I have a wonderful day. You have a good day.